It has been amazing. Yeah, it has been really, really amazing because I joined the BabyGel project immediately after completing my PhD. So it was such a good opportunity to practice what I had been studying in my PhD in real life. Yes, and I had a very supportive team. I was not only practicing it as a person tucked up somewhere, but with a very collaborative team, with partners from the University of Liverpool, from Liverpool School of Tropical Medicine, from University of Bergen, etc. Having this multicultural team, diverse skills, a lot of support was a dream come true for any recent PhD graduate. For me as an individual, the highlight was the growth and the capacity building. Yes, because I was given the opportunity of working with very skilled people who are available for the support. Yes. So from my individual point of view, I had a lot of career growth. By the time I started working on the BabyGel trial, I had published 16 papers. By the time I finished, I'd published over 100 papers, and I learned so many skills during that period in the BabyGel trial. As a Ugandan, my highlight was being able to help so many people. Yeah, over 6,000 mothers and their children were supported during this project, going out to the community and being able to create change even in the midst of COVID-19. Yes, and as also an academic, the opportunity to mentor. I was given an opportunity to supervise PhD students. Yeah, I'd finished my PhD, but here I was as one of the supervisors, of course, in a junior role, being supported by the senior supervisors. I felt very flattered, and very soon I'll have one of my first PhD graduates, who was on the BabyGel trial. So that was that was very flattering. Yeah, that as now a supervisor. Yes. So overall, it was an opportunity for me to climb from being a recent graduate into an independent researcher. We have a lot of maternal and child deaths in our setting, and many of those deaths are preventable. Yeah. The primary question of the BabyGel was a hygiene-related question: that would the provision of alcohol-based hand rub reduce the incidence of infection? That was the primary question. But as part of this trial, there was a lot of support. We would give them a bathing kit, we would give them chlorhexidine for umbilical cord care, but even the day-to-day support. When they came to the health facility, there was a doctor. The project hired a doctor to station in the health center force, which usually do not have doctors. And as a health worker, I saw the difference that can make. The that commitment in maternal and child health will actually save lives even beyond the trial. Yes. So you'd see the confidence they would come with to the hospital, knowing that they know somebody who's going to help them, who has been positioned there. So my aha moment was that actually a change research should not only focus on the science, but should also focus on the change in health. Somebody who's in a research program should have the benefits of getting standard care. Yeah. So I actually saw that being changed, because it's not uncommon to have a mother who's going for an operation, have the operation delayed because they do not have supplies. But this project was taking care of all those supplies. Yeah. So I watched in real time the impact of such small changes onto the general well-being. Yes. And the entire system was very happy. The people who were heading the health facilities were very excited. Yeah, the local leaders were actually very flattered, because it was something that really uplifted the society. Yeah. And the other thing that was very, very beneficial, well, in terms of lives changed, it provided a lot of employment to people in the communities, because we were supporting the community health workers. These are usually ladies who are in the villages, and we're giving them a small stipend for referring mothers to the society. I mean, to the trial. We're also supporting the health inspectors, and you'd watch them during the meetings, yeah, and we're saying, this has really changed. our lives. This happened in COVID-19, you know. I mean, the situation was really difficult. So the trial not only delivered science, but it also led to a change in livelihood of so many people in the villages. Yeah. So that was really exciting to me. Yeah. So the wide benefits of baby gel trial is that it impacted so many categories of people. It impacted the mothers and their children by providing quality care to them beyond the science of the trial, but they got better care during birth and during the early life of their children. It also impacted the workers, yeah, the junior graduates. We employed so many fresh graduates to work on this trial. Now, when you look at them 4 years, 5 years later, their lives have changed. We have a medical officer, a doctor that we employed, who's currently doing their PhD. Yeah, we have one of the staff we employed who's currently taking up a senior role in another university. Myself, when I came onto the Baby Gel project as a lecturer, but now I'm an associate professor. You know, we have so many people who have had an opportunity to do their PhDs. We have graduated people doing their masters. Yeah, these are doctors who are mastering in their fields. And we have had other workers who have gone on to other projects. Yeah, so when you look at Mbale, this place where we are at, the people who worked on our projects actually hot cake because of the training that they got. Their other projects have come and have absorbed them, which I think leads to a better research ecosystem. Yes, that will not, yeah, that will live on. So BabyGel was very, very impactful in terms of the research culture of Uganda, particularly this rural eastern region. Yeah.
It's really hard to put it together as one package, but it's quite a collection of things if you come to reflect about it in the entire PhD journey. One of the things is that we had trainings in Norway at the University of Bergen, and we were trained, you know, in different angles. I personally, I really learned a lot, especially in the design of studies, especially the methods, and also skills in communicating research findings. If you look at the disseminations we had, like at the EDCTP, at the ICTME, so it's quite an experience on how to put research findings together and communicate it to both technical and non-technical audience. And if I have to say, what have I picked that I can carry forward from that? I think I am quite interested in building in the capabilities of communicating public health results in a simple and easy to understand way, but also improve works on evaluating public health interventions at population level to impact on policy formulation and also budgeting for the health sector. Yeah. So these are some of the things. And I also look at a need to expand on the training component. We have had discussion with Professor Antonietta at the University of Exeter on how we can start a master's program in public health economics in Busitema University. So these are some of the things that I think we can carry forward from the PhD training. So my names are Francis Okello, and have been one of the PhD students in the BabyGel trial. In the entire trial, my major focus was working with the hub data supervisors and supporting them on reviews of data quality on a weekly basis, and also to discuss how to improve data handling for the trial. Of course, alongside the PI and other group in the trial. There are many angles you can look at it. Of course, as part of the trial, the immediate aim was to prevent infections and also reduce death in children. That was a major trial objective. But alongside that, the trial set up an arrangement of providing health care to the mothers and their children, including providing a transportation refund if a mother came to the facility to treat a sick child, and also in cases where mothers were hospitalized, they were provided with some little money for subsistence. So this, other than the provision of the angel, was very important in improving access to healthcare. to the extent that the community liked the trial, and some children were named after the trial. Yeah, some children were named BabyGel, you know. I would like, and especially now with the more trainings I've got in public health economics, my major focus is to contribute into the health economics angles of trials. So I love to collaborate, and I think it will be a fantastic opportunity to provide support again and work with another trial group, especially projects that attempt to address public health problem at the household and at the population level. I think they're very important. Yeah. One of the things is that there is already another trial which is running in collaboration with Norway. It's called SOS. And a number of the staff who are in the BabyGel have already joined that trial. I think that's a very good demonstration of a continuation of collaboration. But for me, as a person and from my own angle, is that in the PhD training, we have had discussions with Professor Antonietta, who is a professor of public health at the University of Exeter. She has demonstrated very strong support to give us the capable hands to support a master's training in public health economics, which we think is one of the key deliverable also, which should come along in as part of the health economics package of the BabyGel. So I cherish that collaboration, and I'm really looking forward to working on the details after my PhD, of course, alongside herself with our guidance.